I'm Brent with Mid-America Orthopedics, and I'm a physical therapist at our Kansas City offices. And this month is Physical Therapy Month, and so throughout the month we're discussing some different conditions, common conditions that we see in the clinic, giving you some tips and strategies and some exercises to try to prevent or help with these symptoms. So for today, we're talking about plantar fasciitis. Plantar fasciitis is a common condition that we'll see in the foot. Basically, the plantar fascia is a structural component to the arch of the foot, and it tends to get inflamed as that kind of gets collapsed down. So as you load into that foot, if that's constantly collapsing down, it's stretching out that plantar fascia, creating more inflammation, irritation, and pain. And so common symptoms are pain when you first step out of bed in the morning, and then it kind of gets better as you walk a little bit. But if you're up on your feet all day long, same thing, getting pain and burning in the arches and into the heels. So there's a couple things that we want to work on. One is strengthening up that arch to keep it from collapsing down. And then two, making sure that the muscles, kind of the gastroc and the soleus in the back are staying nice and mobile so that it doesn't put extra stress onto that arch as well. And so one of the easier stretches to work on is just getting a towel and kind of wrapping that on the end of the foot, getting a little pull there just where you're getting a gentle stretch on the back part of the calf, holding for a good 30 seconds, a couple times. You can do that throughout the day. That just helps with some of that mobility back here to take some of that stress off of the arch. The other exercise that we like for strengthening is really doing kind of a combination of strength and balance. And so it's a plantar flexion exercise where you're raising up onto the toes, holding for a few seconds, and then nice and slow coming back down, repeating that, and really controlling that descend coming back down. Holding for a few seconds, 15 reps or so when you're doing it, and that can help strengthen up some of those muscles in the arch. The other part is making sure that you're choosing proper footwear, and so getting shoes that have good support. If you're going to wear sandals and things like that, get the ones with more of an arch or a little bit more support to it. That way you're not having to rely completely on your muscles, and you can rely on some extra help from your footwear as well. So these are some things you can try at home. If you have more persistent pain, you may need a full evaluation from one of our therapists, rather in one of our offices in Wichita, or up here in Kansas City. You can call us at 913-232-9846. Thanks for watching.